Are you dealing with pelvic pain, unusual discharge, or bleeding, and not sure what's going on? You might be missing the early warning signs of a serious infection that can silently damage your reproductive health. Today, we're breaking down pelvic inflammatory disease, what symptoms you cannot ignore, and how to protect your fertility before it's too late. Stay with me. This information could literally change your health future. Let's talk about something every woman should know: pelvic inflammatory disease, or PID. So, what exactly is pelvic inflammatory disease? Simply put, it's an infection of the female reproductive system. That includes four main parts: the uterus, which holds a baby during pregnancy; the ovaries, which release eggs; the fallopian tubes, which carry eggs to the uterus; and the vagina, the pathway connecting the uterus to the outside. Now, pelvic inflammatory disease is most often caused by sexually transmitted infections, especially chlamydia and gonorrhea. These infections can start in the vagina, and then spread upward into the uterus and fallopian tubes, causing inflammation and damage along the way. You might be thinking, why does this matter? Well, pelvic inflammatory disease isn't just uncomfortable. It can have serious long-term effects. It can cause severe or ongoing pelvic pain, and create scar tissue in the fallopian tubes. That scar tissue can make it harder to get pregnant, and increase the risk of complications if you do. That's why early detection and treatment is so important. Getting care quickly can protect your reproductive health and prevent long-term damage. So remember, understanding your reproductive system and knowing the warning signs of pelvic inflammatory disease isn't just helpful. It's essential for your health and future fertility. Now that we know what pelvic inflammatory disease is, let's talk about the symptoms you absolutely cannot ignore. The main symptom of pelvic inflammatory disease is lower belly, or pelvic, pain. This pain is often the first and strongest sign that something isn't right. For some women, the pain can even worsen during sex, making intimacy uncomfortable or painful. But pelvic pain isn't the only warning sign. Other common symptoms include unusual vaginal discharge, which is basically fluid leaking from the vagina that doesn't feel or smell normal; unexpected vaginal bleeding or spotting, even if it's not during your period; and sometimes, pain during a pelvic exam, which can alert your doctor that something may be going on inside. So why does it matter to recognize these symptoms early? Early detection of pelvic inflammatory disease can stop the infection before it causes serious harm. Waiting too long, on the other hand, can lead to chronic pelvic pain or even fertility problems down the road. The key takeaway: listen to your body. If you notice any of these warning signs, don't wait. Getting checked early can protect your reproductive health and your future fertility. Next, let's tackle an important question. Is there a test for pelvic inflammatory disease? The short answer is, not exactly. There's no single, simple test that can confirm pelvic inflammatory disease on its own. Doctors usually make a diagnosis based on a combination of your symptoms, physical exams, and lab tests. So, what does that process look like? First, your doctor or nurse will perform a pelvic exam. This helps them check for signs of infection or inflammation in your reproductive organs. Next, they might run some tests of your urine, blood, or vaginal discharge. These tests help pinpoint any infections that could be causing your symptoms, like chlamydia or gonorrhea, which are common triggers of pelvic inflammatory disease. Depending on your situation, your doctor may also recommend additional tests, like an ultrasound. An ultrasound is a painless imaging test that creates clear pictures of the inside of your body, helping your doctor check for complications or other possible causes of your symptoms. So why does all this testing matter? Early evaluation means faster treatment, which can stop the infection from worsening. It also helps protect your reproductive health, reducing the risk of long-term complications like chronic pain or fertility problems. Remember, if you suspect pelvic inflammatory disease, don't wait. Early testing and treatment can make all the difference. If you're wondering whether you should see a doctor or nurse about pelvic inflammatory disease, the answer is simple: yes, don't wait. If you think you might have pelvic inflammatory disease, get checked immediately. Early treatment is key because it can stop the infection before it causes serious damage. So, why is acting quickly so urgent? Delaying care can significantly increase your risk of long-term problems, including 1. Chronic pelvic pain that lingers for months or even years. 2. Infertility, making it harder or even impossible to get pregnant. And 3. Serious reproductive damage that could require more complex treatments. The bottom line: listen to your body. Don't ignore unusual pain, discharge, or bleeding. Seek medical care as soon as any symptoms appear. Remember, early care means better outcomes, fewer complications, and a healthier future for your reproductive system. Your health is too important to wait. Now that we know how to spot pelvic inflammatory disease and why early care is critical, let's talk about how it's treated. The main treatment for pelvic inflammatory disease is antibiotics. These medications are designed to fight the infection and prevent further damage to your reproductive system. Treatment can come in a few different forms. Some people receive a shot plus oral pills. Others, depending on how severe the infection is, may need hospital IV antibiotics first, and then continue with pills at home. Your doctor will decide which option is best for your specific situation, so it's important to follow their guidance closely. One of the most important things to remember is to finish all your medication, even if you start feeling better. Stopping early can allow the infection to come back stronger, putting your reproductive health at risk. And here's something many people don't realize. If you have pelvic inflammatory disease, your recent sexual partners also need to get medical care and treatment. This includes anyone you've had sex with in the past 2 months. If partners are left untreated, they can reinfect you, undoing all your hard work to recover. So, antibiotics, finishing your prescription, and treating partners. These are the 3 keys to beating pelvic inflammatory disease and protecting your fertility. Good news: pelvic inflammatory disease can often be prevented, and there are clear steps you can take to protect yourself. Since pelvic inflammatory disease is most commonly caused by germs spread during sex, the key is reducing your risk of exposure. Here's how. 1. Use a latex condom every time you have sex. Condoms act as a barrier that can prevent infections from spreading. 2. Avoid sex with partners who show any signs of infection, such as unusual discharge or discomfort. 3. And, of course, abstaining from sex entirely eliminates the risk completely. These simple steps might feel small, but they make a big difference. Prevention not only reduces your chance of serious infection, but it also protects your long-term reproductive health. Remember, taking action now is always better than dealing with complications later. Protecting yourself today can save you pain, stress, and potential fertility problems in the future. If you're thinking about starting a family, it's important to understand how pelvic inflammatory disease can affect fertility. Pelvic inflammatory disease can cause scarring of the fallopian tubes, and this scar tissue can make it harder to get pregnant. Even if you do conceive, women who have had pelvic inflammatory disease face a higher risk of ectopic pregnancy. That's when a pregnancy starts to grow in a fallopian tube instead of the uterus. And if a fallopian tube bursts, it can become life-threatening, so early awareness is crucial. So, what should you do if you've had pelvic inflammatory disease and want to have a baby? The most important step is to tell your doctor or nurse. They need to know your history so they can guide you on safe pregnancy planning, monitor your health, and reduce risks for both you and your future baby. The key takeaway: pelvic inflammatory disease doesn't automatically prevent pregnancy, but knowing your history and getting professional guidance can help you plan safely and protect your fertility. Thank you so much for watching. Now that you know the warning signs of pelvic inflammatory disease and how to protect your reproductive health, it's time to take action and share this life-saving information with the people you care about. If this video helped you, hit that like button. It really supports our channel. Don't forget to subscribe and tap the notification bell so you never miss an important health update. We want to hear from you too. Comment below if you learned something new today, or if you have questions about pelvic inflammatory disease your experience could help someone else. And most importantly, share this video widely with friends, family, or anyone who might benefit. Awareness saves lives, and together we can protect women's health. Stay informed, stay safe, and I'll see you in the next video.